everyone, it's Reena Jadhav here, founder of Health Bootcamps here at SplashX Advent Health at the HB headquarters. And I'm chatting with lovely Fran, who is the global lead for population health at HB. Fran, what the heck's a population health global lead anyway?
I'm glad you asked the question. That's so funny. Actually, population health is sort of the new terminology for what really is public health. So my background is epidemiology, and what we really focus on is looking at the entirety of an individual. What we find is that the reality is that only 20% of an individual's interaction with the clinical care system actually has any direct influence on the outcomes for patients.
Absolutely.
Yeah, and so it's really within the context of that, looking at the individual from a holistic perspective and leveraging technologies as well as the interconnectedness of an entire ecosystem that's their supported individual, which again is centered around the environment in which they live, basically where people live, work, play and pray, right?
Absolutely.
And being able to utilize that environment to be able to influence them in terms of the things that ultimately matter, their environment, their lifestyle, looking at their social economic situations, all of the factors that really lead to, well, basically one getting ill and also helping one to come back to a state of wellness.
And a lot of us are getting ill, Fran.
Yeah.
You know, we're getting more and more sick as a nation. We're here for the mental health conference, but to broaden that out, you look at numbers for chronic illness, we've got over 100 million Americans with some form of chronic illness. We've got this now creeping into the kids, teens. We've got 30% jump in depression and anxiety, mental health illness. So you're right that it's not just genetics, and of course now we've talked about epigenetics as a whole new field as well. When you look from an HB standpoint at what are those factors, so you mentioned environment, play, where are you focused and what technologies are you excited about that you feel can actually move a needle?
Yeah, so that's a big question, right? So I'll try to break it up into a couple of different elements. So first off, there's some really unique things that we're doing from a solution standpoint that are actually not just within the healthcare arena or within that sector. There are other verticals for which we also focus. Education, as well as the workplace of the future. These are all big environments in which we are integrating our technology so that when people are in their work environments that they are feeling good in those environments, right? So taking that notion of ergonomics to a whole different level. But taking it back to the space that I'm in and how we influence it, we really have this strategy that's centered around three key components: care delivery, patient engagement, and population health management. And across the continuum of that, what we do is we take technologies, these innovations, and we interject them. So from a care delivery perspective, putting technology right in the hands of the clinicians to help them not only be able to practice medicine better from the standpoint of diagnosing and treating, but also down to the way that they are communicating and interacting with their patients. From a patient engagement perspective, leveraging our technology so that from the moment that the individual steps into the clinical environment, that they are given the opportunity to have a good experience in that environment. And then further, taking it to population health, where sort of that intersection between the clinicians and the patients, such that both are able to derive at the insights that are necessary for both shared decision making as well as for self-directed care, where the individual is actually empowered to take on a more engaged kind of exercise, if you will, and better health.
And we really do have to get back to where the patient controls their health destiny.
Absolutely.
We've somehow thought that the doctor fixes our health, but really that's not the case. The patient has to fix their health themselves with the help of the doctor and the team. Let's talk diagnostics, which is sort of the first element you mentioned. I don't believe we've cracked the code on accurate, comprehensive diagnostics. What are you seeing coming down the pipe? What technologies are you excited about that can help us solve this diagnostics challenge?
Oh, sure. So, one of them that first jumps out for me is in the area of artificial intelligence in medicine, right? So really being able to start to gather insights, and one way by which doing that is through patient-generated data. So if you think about it from the standpoint of the individual, so common, a patient will go in and say they've got problems, and when they're in front of the clinician, they're not exhibiting any of those symptoms that they're talking about. And so everybody's thinking they're crazy, or in the old days they would tell you, oh, you're just fatigued.
Exactly.
You know, and so,
been there, heard it.
Right. So it's from that standpoint, really being able to take that intelligence and also being able to create things like data lakes, right, where data is coming in from multiple sources, and we're able to then layer on top these new tools, new algorithms that allow for us to gain new insights that we weren't able to do before. And then further beyond that, leveraging things like machine learning. So we're really able to get to an entirely different level with where we're going. And a lot of sophistication, which we also see in areas like virtual reality, use of holographic imaging for 3D view of the body. I mean, just alone, if you think about it, the human body is 3D.
That's right.
And think about for all these years, we've been looking in 2D at the human anatomy. And now to know that, you know, within very recent years that we've been able to leverage 3D holographic technology to begin to view the body in the way that the body truly is formed and exists, has lent us to be able to do things that we just haven't even been able to do in the past.
And with far more accuracy. I mean, colon cancer is a great example.
Yes, absolutely.
Where, you know, finally we're starting to see technology where you can actually do a 3D visual to spot colon cancer instead of this hugely invasive procedure.
Absolutely. And, you know, that's a great one because, it's introducing non-invasive, right?
Exactly.
It's minimally invasive technology. So it's just been incredible. Yeah.
I'm going to ask you one more question on the diagnostics before we jump to the others, which is 45% of women are told that they're hypochondriacs when they go in with certain types of symptoms, and it takes 5 doctors to get to finally a diagnosis, and it's always some form of autoimmune.
Yes.
Are you focused on that at all? Because that's hugely a female-centric problem.
So, you know, I'm going to share something very personal around that and say, first and foremost, yes, I am. My mother was one of those. My mother had myasthenia gravis, and she was diagnosed very late. And at the time that she was diagnosed, she was in fact misdiagnosed. They thought she was having a heart attack when she had what was a myasthenic crisis, where her diaphragm actually had, paralysis and stopped functioning. And so I'm very familiar with that on a personal level. And this is why I go back to this concept of patient-generated data. From the standpoint that we're able to now be able to leverage technologies in ways. Look at it. When a patient goes in, on average, a patient might spend 7 hours with a clinician annually, right?
Yeah.
7 hours on average. So what happens the other, thousands of hours outside of that environment? That's where real things are happening to real people. If you even go into, think about sports performance and, arrhythmias amongst these high performance, athletes.
Exactly.
And yet we, in the past, we just have done a really poor job of being able to monitor patients and stay in touch with the patient population. And I think this is where we have an opportunity to change things. Much of that change is coming through patient consumerism, right?
Yes.
The consumer saying, look, I want this, electing to be very proactive. And that is just making an entire difference in the way that things are happening. The other element to that is literacy. Everyone's going to Dr. Google. We are seeing an increase, a spike. It's needed, though, right?
It is.
We laugh about it, but when you think about the low rates of literacy, not just, and it has nothing to do with education levels.
That's right.
But being able to put this information in the hands of the patients themselves to better equip them to deal with the conditions that they may be diagnosed with, to be able to take better preventative measures. These are the types of things we do. So as I describe these things, underlying are our technologies. So use of HP technology for telehealth medicines and virtual consults. We engage with a very large ecosystem of players who are doing everything from pain management to patient education programs to retrospective studies on post-TAVR and and ablations. Right. Basically, atrial fibrillation patients or stroke patients, utilizing our technologies in ways that significantly matter, and that makes me feel good and to know that we're doing that, and it also makes me feel like I'm doing something on behalf of my own mother, who was just as you described, diagnosed too late.
I'm very, very sorry to hear about that, but I'm so glad that you're working on solutions.
Yeah.
I come to conferences like this and I get so excited.
Yeah.
but then I step outside and it's not fast enough. The change is not fast enough. I think earlier you and I were talking about the fact that, you know, our cell phone is so powerful now. There's so much it can do, and yet we're not leveraging its power for healthcare.
Yeah.
Where do you see, Fran, how can we get out faster with these technologies?
Well, look, you know, the reality is that there's cultural change that has to occur. But there are also some fundamental things that we have to take in consideration, and we cannot afford to overlook in healthcare. And that begins with the oath, right? First, do no harm. So one of the things that we pride ourselves in, particularly with HP, is safer, smarter, and secure for healthcare technologies. It's not enough to say, oh, everybody has a cell phone. First of all, not everyone has a cell phone. Secondly, even if they do have a cell phone, is that the cell phone that you want to use for a very complex, chronic patient, you know, disease patient who's, you know, burdened with multiple disease states? Probably not. So we really have to be, you know, very conscientious about the type of technology we're looking at. Look, if you're inconvenienced by your binge watching, right, all of a sudden your Netflix stops working on you, you might be inconvenienced. Your blood pressure might go up a little bit because you're frustrated, but there's nothing really at risk, right? Your life isn't being threatened or is on the line. So it's really trying to make sure that in the expeditious manner in which we want to introduce these new technologies, that we still uphold some, you know, some standards and the quality of the products that we're introducing. And those are the types of things that we're really putting heavy emphasis on, and for which we're then in turn seeing the medical community being more confident and embracing.
What about business model evolution? Do you feel like we need to evolve the business models, the traditional models, in order for these new technologies to get adopted? Or do you think we don't really need to disrupt those models and we can sort of bring the new technologies in and slide them seamlessly in?
Well, I mean, you've got to be accommodating, right? I mean, you go down to it and you're going to have some, you know, some auditor who's looking at it from a claims adjudication perspective saying, wait a minute, you know, what is this? Because, you know, the nomenclature
doesn't work.
Right? Wait a minute, this is not the nomenclature associated with this particular code, right? So we do have to begin to look at that. The other element is fundamentally, we all recognize the need to move away from the episodic, you know, approach that volume-based medicine, which is why there has been and there's been in this embrace around value-based medicine. And look, it's not just in the United States. My purview and what I'm responsible for is global. And, you know, we see this around the world, both in, in strong industrialized nations as well as in developing countries, this embrace of a value-based system. But what's unique about the models is we see the models being most effective and most efficient in their ability to help improve outcomes is those in which it's much more comprehensive. So it's not just about treating one particular symptom or illness, if you will, but treating the whole individual. And that really necessitates looking at an individual from a body, a mind, and an emotional state of being. And, you know, of course, expanding out of that all the other elements of spirituality and other components as well, which, you know, individually one might recognize as being something that they need in order to, you know, be successful in the management of their care.
So in your role, you have this fabulous eagle's eye view of what's happening in the space and then what's coming down. What is the one thing you're most excited about as you think of that particular thing moving the needle and really changing lives of people in terms of them getting healthier?
Yeah, oh my goodness. You know, there's so many. I mean, if I had to say, you know, first when you started talking, it's like, oh, 3D print. You know, the notion that we're able to, you know, print things in near real time. We're able to integrate, you know, sensor technology into that, which enables us to do things like AI and machine learning and gather. Imagine someone getting a knee replacement or a hip replacement surgery, and we know the temperature, right? We know what we can predict whether it's going to have a failure, you know, and be able to go in and make those replacements very quickly. Those are real things that are happening. Yeah, but then when you look at the other end and you turn around and you're like, whoa, virtual reality, and how we're able to leverage virtual reality to, you know, assist individuals with autism, to reduce senses of isolationism, reducing clinical depression, you know, reducing symptoms of pain. I mean, all of these. It's hard to pick one. It's hard to pick one.
Make a prediction then.
I can't pick one.
Make one prediction.
Make one prediction.
One prediction. What's going to come true? What is something that the world doesn't realize is going to come true in the space of mental health?
Specifically in the space of mental health, I think virtual reality is going to be it.
Okay.
I think that's something that we're really seeing. We're already seeing it now.
Okay.
You know, we right here at Stanford, it's already being, you know, fully integrated in many areas, including anesthesiology. You know, we just had a conference on artificial intelligence in Boston last week, and we talked about how we're deploying it within that environment, and of pain management, and using it as a form of therapy. So I think VR is one of the ones where I could say very quickly there are a lot of wins. But let's make sure that we don't forget that there are a lot of behind the scene things that are happening. And some great examples of that are from a governmental perspective. The FDA's own acknowledgement and recognition of the rapid pace at which the technology is being introduced is a great indicator. And them not wanting to slow down the progress that's being made.
Even for the current administration?
Yes, absolutely. I mean, in many respects, they're wanting to be very cooperative.
Okay.
They're seeking the inclusion and the perspectives of, you know, not only large manufacturing enterprises like our own, but also extending out to the entrepreneurial community to understand the best ways of ensuring the safety, because that's really great. Safety
Absolutely.
First, ensuring the
Absolutely.
safety of our citizens, but at the same time being able to pick up the pace in terms of our ability to be able to make a difference. So, you know, there's a lot that's happening on not only a technological perspective, but also on a policy and a regulatory perspective. You know, we've got a win in the remote patient monitoring. We actually have our own code now for that.
Oh, nice.
Yeah, so I mean, these are big things that are happening, and we don't want to, you know, lose sight of that. They're not the obvious things that are going on, right? It's not evident to everyone.
Right.
But those are the things that are behind the scene that then enable for this rapid adoption, like the adoption of VR, to come to fruition.
Absolutely. Fran, thank you so much.
Thank
This has been
you.
fabulous.
I loved it. Yes. Thank you.